have to pass the Senate bill, or else you're talking about starting from scratch. So we will pass the Senate bill. Once we pass it, the President signs it or doesn't, people would rather he waited until the Senate acted, but the Senate parliamentarian, as you have said in order for them to do a reconciliation based on the Senate bill, it must be signed by the President. So it isn't going to make any difference, except maybe the mood that people are in. But the fact is once we pass it in the House, it's going to be the law of the land, and it will officially decide.
Won't it make any difference? We're hearing from so many of your rank and file that they just don't trust the Senate.
Yeah, well, that's another thing. But the fact is that they're committed enough to extending insurance to 31 million more Americans, to making insurance more affordable to the middle class, for having reforms that say that we end the prohibition on denying insurance to those because they have a pre-existing medical condition. They are committed to the goals of the legislation, and they're strong enough to do it regardless of if the bill is signed on Monday or if it's signed on Friday, because we'll have already passed the bill. So,
speaking of the CBO, they came out with their newest budget number that $9.7 trillion would be added to the debt over 10 years. The smallest deficit in that window would be $724 billion in 2014. Do you intend as Speaker ever to preside over a balanced budget like Hastert or Gingrich did, and if so, what kind of time frame would that be?
Well, first of all, let us reflect upon where that budget deficit came from. We have two wars that were always done on a supplemental, not paid for. We had the tax cuts for the wealthiest people in our country, which were a very major contributor to the deficit in the Bush years, and now the thereafter. Having said that, it is our responsibility to reduce the deficit, and for that reason, I'm very pleased that the Senate has now agreed to have pay as you go. It became the rule of the House the day I became Speaker. It became the law of the land only recently when the Senate agreed that they would abide by pay as you go. Secondly, the President... Excuse me, I'm answering the gentleman's question. The second point is that we have the commission that the President has, by executive order, put forth to take under consideration everything, revenues, expenditures, entitlements, the rest, but to talk about reducing debt. And that has a short fuse. You know, that will be a this year phenomenon. And then the President has asked for a freeze or a cut in the appropriations bills as we go forward. What I say to members when they have an idea or a suggestion for legislation or an amendment to a bill, does it create jobs? Does it reduce the deficit? That is the course we have to take us on. But let me remind you that when President, under pay-as-you-go, under President Clinton, we came out of the Clinton administration, the last 4 Clinton budgets were either in budget or in surplus. We're on a trajectory of $5.6 trillion going in the positive direction. After President Bush's reckless economic policies and tax cuts for the wealthiest and engaging in wars that he did not pay for but just added to the deficit, but even before we got all of that, just in a couple of years, the trajectory changed to about $6 trillion in deficit, a swing of about $11 trillion, bigger than has ever happened in history. We know how to turn that around. President Clinton did it following the Reagan-Bush deficits. We have to turn it around now, and that is our commitment. We do so. Yes, sir.
The Senate, on the assurances from the Senate. I realize Leader Reid can't give you ironclad assurances because of the...
Why not?
Because of the rules of the Senate. But what assurances have you gotten from the Senate that they will promptly take up this reconciliation bill to ease your members' fears?
Well, our members have sent a number of bills over to the Senate which have not been acted upon yet. But let me say that is largely because of the obstructionism of the Republicans. They're requiring 60 votes on every bill. As I've said to you before, Senator Reid has had the votes. He just hasn't had the time to address each one of these issues. So the concern that they had was about what has happened in the past based on the 60-vote rule. under the reconciliation, the simple majority, the constitutional majority, I think members are much more comfortable about the fact that that this reconciliation will happen. Nonetheless, there are certain assurances that they want and that we will get for them before I ask them to take the vote. But I think we're at a very good place because our numbers are coming, you know, what we're seeing from CBO is positive. We want it to be certified so that we can go forward with a scored bill as soon as possible. And again, any hesitation anybody might have about do you trust the Senate is offset by the great vision that they have for health care for all Americans, and that we will be able to do it in a reasonable length of time. It will take a little faith, but what we do always does. Yes, ma'am. Can we do one more there? No? No.
Just on timing, you said yesterday that you would give your members a week to look at the legislation.
Well, I said that they would have at least a week from yesterday before we would have a vote. I hope that we would have the CBO scores as soon as possible so we can go to budget on the beginning of the week and then go on the internet and then take our vote. Thank you. Thank you.
Do you expect the scores today?
You know, it's an independent agency. I wanted them last Friday, and I would hope that we have them today. Thank you.
Thank you.
Thank you.
And the U.S. House turns to President Obama's revised health care plan next week. The Associated Press reporting the president is delaying his trip to Asia next week to focus on health care. The Asia trip was scheduled to coincide